Are you suffering from depression, or do you know somebody who's suffering from depression? It seems to be the next big disease that everybody has. A lot of people don't want to talk about it, but it's very prevalent. And we, through our research in anti-aging, came across depression as one of the causes that is actually causing premature aging. So, looking at depression from the lens of Western medicine, Eastern medicine being Ayurveda and traditional Chinese medicine, we came across a number of factors that can be tied into each other. And doing a cross-collateralized study across these three schools of medicine, what we came across was that there are a number of factors that can cause depression, from emotional trauma to lifestyle to something as simple and as complex as not having a life purpose, or as Ayurveda says, disconnection from dharma. It doesn't matter which religion you believe in or you don't believe in, but not having a life purpose is a huge factor. So, looking at these individually and then doing a cross study of them, what we realized was that one of the things that will really help with depression is having a life purpose. Have a life purpose, follow it with focus, which is then followed with physical activity, which is very important. So let's see how Western medicine defines depression. It's a neuropsychiatric disorder. It's seen on the DSM-5 scale. They'd have a questionnaire for you. You'd go through it. And then they would look at either giving you antidepressants or, offer something like CBT, cognitive behavioral therapy, or DBT, something on those lines to modify your behavior so you are able to live relatively better and get out of depression. Now, this is a great approach. The results that you get from antidepressants are almost instant compared to what you get from Ayurveda and TCM. Well, it's not completely instant. It's not like having a painkiller. It does take time to build up in your body, but it's still pretty rapid. The problem with that is it does cause dependence. Sometimes it has side effects and interactions. And a lot of people that do get onto antidepressants then come off, and so on and so forth. Now, if you're on antidepressants, please do not get off them. Consult your mental health care provider, because it can be very dangerous. But let's get into Ayurveda. Ayurveda says depression is because of an imbalance between Vata and Kapha, being the air and water elements. Again, it takes it down to toxic lifestyle, emotional trauma, and disconnection of dharma, as I said earlier. It's essentially one of the ways of treating depression is using adaptogens like ashwagandha, right? Again, going on an adaptogen for a long term, and a lot of people are using it, is not an ideal way of treating a disorder of the mind. And then if you look at traditional Chinese medicine, how does that view depression? Well, they say it's stagnation of liver qi, and also disharmony between heart and spleen. Spleen is, in Chinese medicine, the organ that gets impacted the most with worry and anxiety and so on and so forth. So it's essentially an emotional disturbance of the Shen being the mind. So again, traditional Chinese medicine sees it as a blockage and disharmony. Same thing in Ayurveda, it's a blockage and disharmony. The amount of research on both of them being backed by clinical research and clinical studies is still limited. And if you go back and look at depression from the Western medicine concept, and you look at what antidepressants are doing, is also moving energy through body and through mind. So that's where my first point comes in, that once you have a purpose and you focus towards that purpose, life purpose as we call it, and then you work towards it, when you're focused, you're creating energy. Energy needs to be created at the mental level, where you have focus, you have purpose. It needs to be created at a physical level, where you're basically giving yourself a natural shot of serotonin and dopamine. One of the great ways of dealing with depression is having a routine in life. If you can work out a routine where you're sleeping at a certain time, getting up at a certain time. What you're doing is you're working your Chinese medicine clock, where every hour is dedicated to a certain organ of the body and its healing. So also it keeps you regular in the way you operate. So it kind of instills a level of discipline, which helps in you coping with depression and then getting out of it eventually. The other thing is physical activity. If you have a regular routine of exercise, whether it's qigong, tai chi, or form of yoga, or just going in, hitting the gym, doing something with weights or doing intensive cardio if your health allows it, you're going to see that you feel better as the endorphins are running through your body. Serotonin, dopamine, from a Western medicine perspective, is working. Now, if we're doing that and then you're taking some adaptogens like the ashwagandha within limited quantities, of course, do not abuse it. A lot of people are using it. You need to have a focus that I want to be off the adaptogens and want to work with just the purpose and the moment, and then follow it up with a diet as well. When we talk about stagnation of liver chi, disharmony between heart and spleen, your diet has a huge role in it. Are you eating junk food? How do you feel after that? Are you having sugary drinks? Are you getting addicted to alcohol? Look at all these factors in your life. So essentially, step back, make a chart, look at these factors, work on a purpose, and have a commitment to yourself that you are going to get out of depression no matter what. And it's you only who can get out of depression. Nobody else can really pull you out unless until you're prepared to get out. And keep toxic people, toxic food away from your life. Wishing you good mental health.